In my previous video, I had spoken about impedance, resistance and reactance. In this video, I am going to talk about the technique which can measure these parameters. The forced oscillation technique. It is also abbreviated as FOT. In this figure, you can see anti-biased forced oscillation device. As the name suggests, this technique uses oscillations or sound waves to study the lung function. Now let's talk about what are sound waves and frequencies. This is a tuning fork, and I'm sure that every one of you must have used or done this experiment in school. This is a tuning fork. When you hit this tuning fork on a solid surface, it produces waves of different frequencies. Now these waves are nothing but compression and rarefaction of airway molecules. A wave has got a property called as frequency. In a wave, if there are 4 cycles, point to remember, pressure waves of different frequencies travel up to different distances in the lung. The pressure wave of a low frequency, that is 5 Hz, it penetrates out to the lung periphery, while a high frequency of 20 Hz can travel only till the proximal base. Now let's take a look at the different generations of airways over here. There are 23 generations of airway, and if you send a frequency of 20 Hz, it can travel till the bronchioles, it can travel till the 8th generation. When you send a low frequency of 5 Hz, it can travel all the way from the trachea till the alveolar spaces, that is till the 23rd generation. Now this is a anti-biased FOT device in which the patient is breathing. When the patient is breathing in the device, it can measure the flow, it can measure the volume, and it can measure the associated pressure changes. And when you record the pressure change upon flow, this ratio is nothing but the resistance which is offered to the airflow. While the patient is breathing, now the breathing pattern over here is shown in yellow. When the patient is breathing in the device, this device emits sound waves of different frequencies. For instance, when the patient is breathing, pressure wave of say 5 Hz is sent inside the lung. This pressure wave is overlapped on the breathing of the patient. Now when the pressure wave is sent inside, certain energy is required to propagate the sound wave or the pressure wave inside the lungs. If you send a frequency of 5 Hz, certain amount of energy is required to propagate the frequency of 5 Hz. And we know that the 5 Hz frequency travels from the mouth till the periphery of the lung. When you send this frequency, there is a pressure change, say P dash upon flow. Now this ratio tells you about the resistance offered by the lung for the frequency of 5 Hz. That is, the resistance offered by lungs to 5 Hz frequency is the ratio of pressure required to propagate wave of frequency 5 Hz to the flow. Similarly, the resistance offered by the lungs to the 20 Hz frequency is the ratio of pressure which is required to propagate a wave of frequency 20 Hz on flow. It's simple. If you require more pressure to propagate the frequency of 5 Hz, that means there is an obstruction in the path of the 5 Hz frequency, and because of which the resistance offered to the 5 Hz frequency is increased, and the resistance in the entire path is increased, and it means that the obstruction can be anywhere in the path traveled by the 5 Hz frequency. Similarly, if the pressure required to propagate the frequency of 20 Hz is increased, it means that there is an increased obstruction in the path traveled by the 20 Hz frequency. and the path traveled by the 20 Hz frequency is from the trachea till the larger airways. In FOT, we get two graphs. One is the resistance versus frequency and the other is reactance versus frequency. Now let's take a look at the resistance versus frequency plot. Resistance measured at different frequencies is plotted. An important point to note is, in a normal healthy airway, the resistance measured at different frequencies is almost the same, and we get a straight line. Now let's take a look at the another scenario over here. The resistance measured at the 5 Hz is increased compared to the normal. Similarly, the resistance measured at 20 Hz is increased as compared to the normal. However, the resistance, when you compare the resistance measured at R5 and R20, they are increased in proportion to each other, and you get a straight line which is normal, which is parallel to the normal line. And this happens in proximal airway obstruction. Now let's take a look at the another scenario here. Resistance at 5 Hz, you can see that the resistance at 5 Hz is increased as compared to the normal. At the same time, the resistance at 20 Hz is also increased compared to the normal. However, R5 is increased However, the increase in R20 resistance is not in proportion with R5. This happens in distal airway obstruction. R5 is increased way much as compared to R20. The other graph that we get is reactance versus frequency. We know that a reactance is made up of two components. One is the elastance and the other is inertia. So reactance is plotted against frequency. At a lower frequency, the elastic properties of the reactance are dominant. At high frequencies, the inertance become dominant. When we draw this line, you get a point on this line which is the x5, that is the reactance measured at 5 Hz, and a point where the reactance is 0, that is called as the resonant frequency, RF. Now the area on the left side of the resonant frequency tells you about the elastic properties, and that is denoted by AX. The area on the right side of the resonant frequency tells you about the inertance. Now let's take a look at this scenario over here. You can see that the X5 has become more negative and the resonant frequency has increased. It has shifted towards the right, and the area AX has also increased. Increased AX tells us that the elastic properties of the lung are hampered.